How does genioglossus advancement compare to other sleep apnea surgeries? If you are curious about how genioglossus advancement stacks up against other surgical options for sleep apnea, you are in the right place. Let's break down the details to give you a clear picture. Genioglossus advancement is a surgical procedure aimed at treating obstructive sleep apnea by repositioning the tongue muscle attachment. This procedure specifically targets the genioglossus muscle, which is the largest muscle in the tongue. By moving its attachment on the lower jaw forward, the airway is enlarged and stabilized. This helps prevent the tongue from collapsing backward during sleep, a common issue for those with obstructive sleep apnea. When we compare genioglossus advancement to other surgeries, such as uvulopalatopharyngoplasty or UPP, we see some notable differences. Genioglossus advancement is often combined with UPP or other procedures to address multiple areas of airway obstruction. Studies indicate that when genioglossus advancement is added to UPP, the success rate improves significantly. For instance, the success rate after 12 months for UPP alone is about 56%, while it jumps to over 95% when genioglossus advancement is included. In terms of surgical success and apnea-hypopnea index reduction, combined procedures that include genioglossus advancement achieve a reduction of approximately 55 to 58% in apnea-hypopnea index, which measures the severity of sleep apnea. The success rates for combined procedures hover around 61%, which is defined as at least a 50% reduction in apnea-hypopnea index and a postoperative index below 20 events per hour. Now, let's look at tongue base advancement, another surgical option. While tongue base advancement also shows high effectiveness, studies suggest that UPP combined with tongue base advancement has a slightly higher overall effectiveness compared to UPP with genioglossus advancement. The procedure itself is performed under general anesthesia. An incision is made inside the lower lip to access the lower jawbone. A small section of bone, where the genioglossus muscle attaches, is moved forward and secured with a titanium screw. This method does not involve moving the teeth or the entire jaw, making it less invasive. Recovery involves healing of the soft tissues and bone, with improvements in airway function typically observed within a few months. Patients who undergo genioglossus advancement often report better daytime alertness and reduced snoring. When combined with UPP or hyoid suspension, this procedure leads to significant reductions in apnea events and an overall better quality of sleep. In summary, genioglossus advancement offers a targeted approach to treating obstructive sleep apnea, especially when paired with other surgical options. It effectively enlarges the airway at the tongue base, leading to higher success rates compared to UPP alone and comparable outcomes to other tongue-based surgeries. This makes genioglossus advancement a solid choice for those struggling with obstructive sleep apnea, particularly if multiple areas of obstruction are present.